Moyamoya disease is a rare and serious blood vessel disorder that affects the brain. It is characterized by the narrowing or blockage of the carotid artery in the skull, which is responsible for supplying blood to the brain. This reduced blood flow triggers the development of tiny blood vessels at the base of the brain in an attempt to compensate for the lack of blood supply. If left untreated, Moyamoya disease can lead to stroke, cognitive and developmental delays, and other complications. In this video, we will take an in-depth look at Moyamoya disease, its symptoms, causes, and potential complications. We will also discuss when to seek medical attention and how it can affect both adults and children. By understanding this rare condition, we can take preventive measures and seek immediate treatment if necessary. Moyamoya disease is a rare cerebrovascular disorder that was first described in Japan in the 1960s. The term moyamoya translates to puff of smoke in Japanese, which reflects the appearance of the abnormal blood vessels that develop in the brain as a result of this condition. The exact cause of Moyamoya disease is still unknown. However, research suggests that genetic factors may play a role. Studies have shown that people with a family history of Moyamoya disease are more likely to develop the condition. In addition, it has been reported to occur more frequently in people of East Asian descent, especially in Korea, Japan, and China. Moyamoya symptoms. Moyamoya disease can occur at any age, but it is most commonly diagnosed in children between the ages of 5 and 10, and in adults between the ages of 30 and 50. The symptoms of Moyamoya disease vary depending on the individual's age and the severity of the condition. In some cases, it may present with no symptoms at all. Symptoms in children. In children, Moyamoya disease often presents as a stroke or recurrent transient ischemic attack, TIA. A stroke occurs when there is a sudden interruption of blood flow to the brain, leading to brain cell damage. On the other hand, a TIA is a temporary disruption of blood flow to the brain, which can cause symptoms similar to a stroke, but typically resolves within a few minutes. Other potential symptoms of Moyamoya disease in children include headaches, seizures, difficulty speaking or understanding language, facial paralysis or weakness, vision changes. It is essential to seek immediate medical attention if your child experiences any of these symptoms, as early detection and treatment are crucial in preventing complications. Symptoms in adults. Adults with Moyamoya disease may experience symptoms similar to those in children, such as stroke or TIA. However, they may also experience bleeding in the brain, known as a hemorrhagic stroke. The most common symptoms of a hemorrhagic stroke include sudden and severe headache, nausea and vomiting, dizziness or loss of balance, blurred vision, difficulty speaking or understanding language, numbness or weakness in the face, arms or legs, confusion or memory problems. If you experience any of these symptoms, seek immediate medical attention. When to see a doctor. As mentioned earlier, spotting the symptoms of Moyamoya disease early is crucial in preventing complications. If you or your child experience any of the symptoms mentioned above, seek immediate medical attention. Your doctor will conduct a physical examination and may order imaging tests, such as an MRI or CT scan, to confirm the diagnosis and assess the severity of the condition. Early detection can lead to prompt treatment, which can help prevent a stroke or other complications. Moyamoya causes. As mentioned earlier, the exact cause of Moyamoya disease is unknown, but it is believed to be linked to genetic factors. Over the years, researchers have identified several genes that may play a role in the development of this condition. These genes are involved in blood vessel formation and function, and any mutations in these genes can lead to abnormalities in the blood vessels in the brain. In addition to genetics, other risk factors for Moyamoya disease include age. As mentioned earlier, Moyamoya disease is most commonly diagnosed in children and adults between specific age groups. Gender? Females are more likely to develop this condition than males. Race? People of East Asian descent have a higher risk of developing Moyamoya disease. Family history. As mentioned earlier, having a family member with Moyamoya disease increases your chances of developing the condition. Complications of Moyamoya disease. If left untreated, Moyamoya disease can lead to serious and potentially life-threatening complications. These include stroke. The most common complication of Moyamoya disease is a stroke. As mentioned earlier, this occurs when there is a sudden interruption of blood flow to the brain, leading to brain cell damage. Depending on the severity and location of the stroke, it can result in permanent brain damage, disability, or even death. Cognitive and developmental delays. Moyamoya disease can affect the normal functioning of the brain, leading to cognitive and developmental delays in both children and adults. Children with Moyamoya disease may experience learning difficulties, speech problems, and developmental delays. In adults, This condition can lead to changes in behavior, memory problems, and difficulty performing daily tasks. Bleeding in the brain. In some cases, Moyamoya disease can lead to bleeding in the brain, known as a hemorrhagic stroke. This occurs when a blood vessel ruptures and causes bleeding in or around the brain. This can be life-threatening and requires immediate medical attention. Treatment options for Moyamoya disease. The primary goal of treatment for Moyamoya disease is to improve blood flow to the brain and prevent further complications. The specific treatment option will depend on the individual's age, overall health, and the severity of the condition. Medications. Medications are often used to manage the symptoms of Moyamoya disease and reduce the risk of stroke. These may include aspirin. This is a blood-thinning medication that helps prevent blood clots from forming. Blood pressure medications. High blood pressure can damage blood vessels, so your doctor may prescribe medication to help lower your blood pressure. Seizure medications. If you have seizures, your doctor may prescribe anti-seizure medication to control them. Surgery. Surgery is the most effective treatment option for Moyamoya disease. It aims to restore blood flow to the brain by bypassing the blocked or narrowed arteries. The two main surgical procedures used to treat this condition are direct bypass surgery. In this procedure, a healthy blood vessel is taken from another part of the body and attached to the affected artery to bypass the blockage. Indirect bypass surgery. In this procedure, a small piece of tissue is placed on the surface of the brain, which triggers the growth of new blood vessels to compensate for the lack of blood supply. Your doctor will determine the most suitable surgical option based on your unique condition. Lifestyle changes to manage Moyamoya disease. In addition to medical treatment, making certain lifestyle changes can help manage Moyamoya disease and reduce your risk of complications. These include quitting smoking. Smoking increases your risk of developing a stroke, so it's essential to quit smoking if you have Moyamoya disease. Eating a healthy diet. A diet rich in fruits, vegetables, whole grains, and lean protein can help improve your overall health and reduce your risk of complications. Engaging in physical activity. Regular exercise can help lower blood pressure, improve heart health, and reduce your risk of stroke. Managing other health conditions. If you have other medical conditions such as high blood pressure or diabetes, it's crucial to manage them effectively to prevent further damage to your blood vessels. Moyamoya disease is a rare and potentially life-threatening condition that affects the blood vessels in the brain. Early detection and prompt treatment are crucial in preventing complications such as stroke and cognitive delays. If you or your child experience any of the symptoms mentioned in this article, seek immediate medical attention. By understanding the causes, symptoms, and potential complications of Moyamoya disease, we can take preventive measures and seek appropriate treatment to manage this condition effectively.